Circumcision is one of the most debated medical procedures for newborns, and for many parents, it's a decision that raises questions about its health benefits, potential risks, and cultural or religious significance. If you're considering this procedure for your newborn, you may be wondering, is it the right choice? What are the benefits? And what does it really involve? Let's dive deeper into the facts and help you understand what circumcision is all about, and how to make an informed decision for your baby's health and well-being. Circumcision is a surgical procedure where the foreskin of the penis, the fold of skin covering the head, is removed. While it's a routine procedure in many parts of the world, including for cultural or religious reasons, there are also medical justifications. Some believe it can lower the risk of certain infections, including urinary tract infections, UTIs, sexually transmitted infections, STIs, and even penile cancer. The procedure can also help prevent conditions like phimosis, where the foreskin becomes too tight to be pulled back over the head of the penis. For some parents, circumcision is a deeply held religious or cultural practice. In religions like Judaism and Islam, circumcision is seen as a rite of passage, often performed within the first few days of life. But regardless of cultural or religious views, there are medical perspectives to consider as well. Studies have suggested that circumcision may offer benefits, such as improving hygiene by making it easier to clean the area around the penis. Additionally, because the removal of the foreskin can reduce the risk of certain infections, some healthcare providers recommend it for preventive health care. However, the medical community is divided when it comes to the health benefits of circumcision. While some argue that the advantages outweigh the risks, others point out that good hygiene and regular care can be just as effective without the need for surgery. In fact, major medical organizations like the American Academy of Pediatrics, AAP, state that while circumcision does have health benefits, they are not so significant that they warrant routine circumcision for all newborns. Instead, the decision is typically left up to the parents, who can weigh the medical evidence alongside their personal, cultural, and religious beliefs. The procedure itself is generally quick and is often performed within the first few days after birth. It is usually done under local anesthesia to minimize discomfort for the baby. Afterward, parents are instructed to care for the circumcision site by keeping it clean, applying ointment, and monitoring for signs of infection. While most babies recover within a few days, there can be some redness, swelling, and tenderness in the area, which is completely normal. As with any surgical procedure, there are risks involved. While complications are rare, there is a possibility of infection, bleeding, or injury to the penis. That's why it's crucial to have the procedure performed by a qualified healthcare provider who can ensure the procedure is done safely and with minimal risk to the child. The decision to circumcise can be a personal one, and it's important to have open discussions with your healthcare provider. They can provide guidance, discuss the potential benefits and risks, and help you understand what's best for your child. In the end, the choice is yours, and it should be made with your baby's health and comfort in mind. Whether you decide to proceed with circumcision or choose not to, what matters most is that you make an informed decision, one that's right for you, your baby, and your family. And always remember, the goal is to ensure the health, well-being, and happiness of your newborn.